Good morning, everyone. Welcome to Carilion Pediatric Grand Round. Thank you for joining us in person or virtually. We're thrilled to have back Dr. Michael Hart as our presenter. I'm personally getting a little worried about the meaning of the word retirement because nobody that has retired from Carilion seems to stay retired from Carilion. Dr. Hart is currently a professor of pediatrics at Virginia Tech Carilion School of Medicine and the former director, and I believe founding chair of director of pediatric gastroenterology and nutrition at the Carilion Clinic. He obtained his bachelor's degree in nutrition at the University of California, Davis, and his master's degree in nutritional biochemistry at the University of Nebraska Medical Center in Omaha, where he subsequently obtained his doctorate. His doctor in of medicine. Boy, your words are not coming today. He completed his pediatric internship and residency at UCLA in Los Angeles and his pediatric gastroenterology and nutrition fellowship at the University of Nebraska Medical Center. He's a past member of the American Academy of Pediatrics Executive Board and GI section. He's a past editor of the AAP Grand Rounds newsletter and a past chairman of the Clinical Practice Committee for the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. Please join me in welcoming back Dr. Michael Hart.
It is great to be here. I really love being here and being back and so forth. We moved back from Myrtle Beach to Virginia. My oldest grandchild is just starting Liberty in a couple weeks. She just graduated from high school, so it's great to be back here. Myrtle Beach was fine to visit, but I wouldn't recommend living. Unless you like sweating a lot, oh well, it is what it is. But it's really great to be here, and for those of you online as well as in person, I love pediatrics, and I love nutrition. And no other discipline that we deal with impacts our kids for 80 years, like we do. Now, I wish the room was jammed with OB folks, too, because in truth, we all know as that brain is developing prenatally, it is so critical that these kids are being formed in utero, obviously. So I'm going to talk about that, but I want to encourage you to brush up with your OB colleagues, because a lot of times our OB colleagues don't appreciate the impact that nutrition has on the development of that growing child in utero. And many times, the first time we get a crack at them, we talk about how prenatal visits would be awesome. Well, the reality is, many times, and most of the times, the first time that you interact with that baby and mom is in the hospital nursery. It just is what it is. But that having been said, it's still really important, because we have, I'm going to show you some data just to blow your socks off, in terms of the importance of nutrition maternally, and obviously postnatally for that first 1,000 days. So we're basically talking about, I am a speaker, I said for Reckitt Pharma, I'm not getting paid for this, and they're not aware I'm doing this, but it's really an important issue, and I want to talk to you this. Our objectives this morning are to discuss the impact of nutrition growth and development the first 1,000 days. When I talk about 1,000 days, I'm talking about conception through the second birthday, okay? So that's really important to understand, because we all know the importance, of folic acid, all these other kinds of things from conception on. In fact, we're beginning to appreciate more and more, the importance of some of these nutrients on very early stages of development. It's critically important. And the role of maternal nutrition is huge. We're going to talk about the effects of prebiotics and human milk oligosaccharides, because breast milk, for example, has 200 known prebiotics, and another 200 they haven't been able to fully characterize pharmacologically in terms of structure and so forth. But these are really important issues. The prebiotics are to the gut like fertilizer is to your lawn. Probiotics are like grass seed. So it's important to recognize that, as you guys know from those of you who receive my emails, informative stuff, the microbiome is a hugely important, increasingly important thing in all aspects of our life: inflammation, growth, normal development, and so forth. So we're going to talk about the role of the essential fatty acids, DHA and ARA. They still are important. They've always been important. In fact, essentially, when I was a GI fellow, we were studying these back. I'm showing you some data from the early 80s, whereas primate data on the impact of development, and we're starting to understand a lot of this forebrain and so forth. I'll show you some great data, because this is something we can't take for granted. And last time I talked about probably the biggest change in formula, the biggest change in nutrition that we've come to recognize in the last 50 years has been MFGM, milk fat globule membrane. And so we're talk about what it is and how it impacts growth, development, and so forth. So we all know how important it is, the long-chain polyunsaturated fatty acids. They play a huge role. The prebiotics I mentioned here, we talk about specifically how they impact the gut, infant growth and development. The LC-PUFAs, we know for a long time, as we sit here right now, 20% of the gray matter of our brain are long-chain polyunsaturated phospholipids. 60% of the phospholipids of our retina are long-chain polyunsaturated DHA-containing phospholipids of the retina. But we can't synthesize it biochemically. We lack the 6-desaturase enzyme to take it from precursor omega-3, like linolenic acid, through to DHA, yet we structurally depend upon that biochemical phospholipid in our gray matter and in our retina. So we must get it, and mom must get it from the diet or supplements or whatever we take. So that's where we're beginning to recognize a lot of these factors come into play. And the MFGM component has been shown to be impactful as far as brain development and the immune system. We know also, we see this from a variety of things, from primate data, but also from just adoption centers, the importance of not just nutrients to lay the groundwork, but stimulation. We see this from orphanage studies and so forth, where kids are just left to plop in the bed and so forth. That impacts growth, development, cognition long-term. So we have to lay the groundwork with good nutrition, but it needs nurture as well as nutrition. That stimulation is critically important. And this is probably the $64,000 slide, if you will. Many of you who receive my regular emails that I send out know the importance of that when you look at it in terms of overnutrition. Can you guys see my cursor? I don't know if it shows up on there or not.
Yeah.
It does.
It does.
Okay. So when you look at maternal nutrition, critically important. Critically important. You know, the whole role, we talk about that specifically. You know, you guys are blessed with having some really outstanding breastfeeding advocates. You know, Rachel Gagan joined the office here, fabulous. Cameron Johnson. These are two women that are committed to work with all the lactation consultants and so forth, because breast milk is the gold standard, okay? We all know this, but maternal nutrition impacts breast milk quality. So we now have a responsibility, not just to ask mom if she's nursing, but to ask her, what are you eating? What are the levels? And we all know that I'm a big believer in some of the roles of the macronutrients and micronutrients which we'll talk about. We all know about vitamin D status. I send notes, seems like all the time, about not just the importance for bone and development, but vitamin D status has legion effects, you know, on growth and development and inflammation, cardiovascular effects, and so forth. And maternal vitamin D status, if mom is not being checked in pregnancy and not being supplemented, her kids have a higher instance of allergic manifestations and autoimmunity and things like that, that really is a big deal. So it's important for us to assess this. And you guys are at the forefront, you're at the cutting edge of making this assessment, you know, on the moms. And data shows I can supplement moms and actually boost her breast milk levels of vitamin D. Can't happen with all the nutrients, but it does. And I can actually improve that baby's level. We're seeing that even though the American Academy has recently adjusted their recommendation levels for vitamin D, they're still probably way too low. Honestly, they're still, but we're not told to check these levels very often, certainly not in kids. But I think mom should have it checked at the onset of pregnancy, you know, when she is being first diagnosed being pregnant. You know, really needs to have not just her CBC and so forth, we need to be checking that. So food pollutants play a role, LC-PUFA intake plays a huge role, we'll talk about that more specifically. The maternal microbiome, big deal. We all know how babies are born makes an impact, whether they're born C-section versus vaginal. Vaginal delivery is when moms seed the baby's microbiome. I'm sorry, I'm giving feedback from my phone. I don't know if you guys have your phone sometimes talk. My hearing aids have Bluetooth with my phone. So I'm sitting here all of a sudden, The woman who watches my dog has posted a dog video of my golden doodle. I said, she's talking to the golden doodle. I said, what the? So if I look, I haven't had a stroke. I just want you guys to know. I said, who's talking to me? So anyway, bottom line is, we know that the whole maternal microbiome is vaginal delivery is better than C-section. Just because a woman's had a C-section before doesn't mean she can't have vaginal. Those kinds of things are important because we're learning to realize that microbiome that mom gives the baby is hugely important. And unfortunately, we are really good at killing bacteria. So for the neonatology, the nursery, you have premature rupture membranes or whatever, what do? Well, amp and gent and do the septic workups. And I tell parents, using antibiotics, huge broad spectrum antibiotics, is like you coming home this afternoon and seeing that your lawn has some dandelions in it. You can spray Weed Be Gone and kill your dandelions, or you can spray Roundup. It kills your dandelions, it kills your lawn too. We tend to use a lot of Roundup in antibiotic use in pediatrics. We're getting better. All of our parents, unfortunately, back when you guys were infants, your parents would bring you to see us, and they expected to walk out of that office with an antibiotic prescription. Little overdose, oh, gotta be some amoxicillin or whatever. Now we're getting better, understanding the impact that these antibiotics do not have negative, they do not have neutral effects, they frequently have negative effects. So we recognize that with mom. We have infant nutrition, we'll talk about that more specifically, the prebiotics, probiotics, and the human genome. All this interacts. This methyl donors is important because methyl donors oftentimes, kind of help us either turn on, turn off genetic aspects that kind of have a big role. We know that the nutrients, and there are some that are conditionally essential. We recognize that some of the methyl donors, the choline and so forth, are conditionally necessary for normal growth, and all of these nutrients here are listed. Very important to recognize them. We know that the role of long-chain polyunsaturated fatty acids, as I mentioned to you, 60% of your retina, 20% of your forebrain, are LC-PUFA containing, but we have to take them from the diet. These are phospholipids, and they have hugely important things, modulate the immune response. We all know this. If we ever take aspirin or non-steroidal, we're basically interfering with this inflammatory, pro-inflammatory, anti-inflammatory effect. These are anti-inflammatory drugs that inhibit, long-chain polyunsaturated fatty acids. So it resolves the eicosanoids. Glucosanoids are really a critical part. So we know that infants and children need a nourishing diet and a nurturing environment to support healthy brain development. Nutrition, environment, microbiota compose long-term effects in terms of health, lifelong, and they modify inflammatory molecular pathways as well as the immune response mediated primarily through that microbiome. Nutrition, critically important for that first 1,000 days of neurodevelopment and immune development. So let's talk about fatty acids, because that's been one of the things that has been a major step forward in the last 25 years, was the recognition. Because if you remember back, if you look at some of the old laws, that it used to be, until the most recent, the early 1980s law passed for infant formulas, that they said you had to have omega-3. We knew that omega-3 fatty acids were essential. Our bodies could not make omega-3 or omega-6. We can make omega-7. So we had a deficit automatically. We recognized that you had to add in these long-chain polyunsaturated fatty acids. But we didn't know at the time, we thought, I'll just use vegetable oils, things like safflower oil, sunflower oil, that are good sources of omega-3. But the problem is that because we have a desaturase inhibition, that 18 omega-3 and 18 omega-6 fatty acids, I can't give you enough to drive up your DHA level, which is what you need structurally and functionally. So that's where it has to be taken as preformed DHA in the diet. We see that the fatty acid accrues during the last, really the last trimester of pregnancy. So when these kids are born at 30 weeks, look at the deficit they end up with fetal body fat accretion, and likewise with the stage of gestation with the umbilical plasma. So it turns out that babies are smart enough, or babies, that they store a lot of the essential fatty acids in their adipose tissue. And it's felt that this is a mechanism by which, when the kids are born, they can transfer from that adipose tissue to the developing brain, sort of have the precursor nutrients available to that brain. This is, I don't want to make you nauseous so early in the morning, but this is a biochemical pathway for DHA synthesis, and right smack there in the middle. You can see on the left-hand side, these are 18 omega-6, 18-2 omega-6 linoleic acid, and on the right is the alpha-linoleic 18 omega-3. And you see where they end up basically come down in their inflammatory pathways down here, the end product down here in the lower right is DHA, on the upper left there's ARA, but the delta-6 desaturase is rate limiting. Studies have shown us that studies of giving breastfeeding women, that they basically were giving them huge amounts of vegetable oil. And they weren't able to drive up their breast milk levels of preformed DHA because of the rate limiting step. So it's really important when you look at DHA levels worldwide, and this is looking at DHA in this case in light blue and ARA in dark blue, you see that it really varies depending on mom's diet, as you would expect. As a monogastric animal, we can modify our tissue levels. That's why pigs can be modified, but cows have a more difficult time because cows are ruminant animals, and the bacteria saturate things in the rumen. So you can't really modify lipids that much for cows, but sure as heck for humans and for pigs. Any monogastric animal, that basically we are what we eat. So we basically put in our tissues, and this is important because we now know that breastfeeding is the gold standard, but your breast milk levels of DHA and other nutrients vary depending on mom's diet. We try to compensate for this. We try to offer prenatal vitamins and some of these things, but maternal counseling and diet is critically important. You guys get it. Unfortunately, I don't think our obstetrical colleagues focus as much on nutrition as we do in pediatrics, as I wish they would in pregnant women, because it's critically important to have all of the structural precursors there for that child's growth and development. If you look all the way to the far right, donor milk. We don't understand why, but donor milk levels of DHA are really low. And I have a theory that makes me think that when moms are now just pumping to sell to the breast bank, that they're probably dropping off their prenatal vitamins that are a source of DHA containing. They took them, and oftentimes, I feel very much a believer in, moms should be started at the time of diagnosis. Moms should have their levels checked in the CBC and a vitamin D level and so on. You don't need to do trying tetraene levels for essential fatty acid. You just need to supplement. So there's some very good supplements on the market that have DHA-containing prenatal vitamins in them, and they really need to have that done. And they need to continue taking those as long as they are pumping their breast milk. Because if their breast milk goes to another baby in our nursery, I want that breast milk to have the high DHA levels, and that's, if you go industry-wide across donor milk, it's not. So it's really important for us. These nutrients that are so critically important that moms need during pregnancy, including the omega-3 fatty acids. And this is a challenge for us because omega-3 fatty acids have long come from fish. I remember back in the 90s seeing a picture in Life magazine when it still was being published, had a picture of salmon, salmon fish counter, and said it's fish brain food. Because we were starting to understand, based upon primate studies, early human studies, that, wow, yes, DHA levels make a huge difference in vision and cognition for babies when they're sufficient. When moms are getting adequate levels prenatally, and then the babies, if they're not breastfed, get it in their formula. But about that same time, we saw, if you remember back, I remember I was a resident in 1982 to 85, thimerosal was already becoming a concern. And just like that was in the we had pertussis vaccine before we had that was a whole cellular kid-driven seizures from the really bad news. Now we have basically a pure form that causes a lot fewer side effects. But the bottom line was it really was a concern. And we then started seeing a lot of autistic families who were convinced that their child's autism was caused from the mercury being poisoned in thimerosal. You guys probably have anti-vaxxers that still bring this up today, as being a concern, because mercury is used as a preservative. Well, the data is all, safe, but the reality is that perception is a reality. If you've got an anti-vaxxer family and they're convinced, then all of a sudden you see fish intake decline. Because fish intake, depending on where you live, in all 48 contiguous states, every waterway, Missouri River, Ohio River, has been shown to be heavy metal contaminated, mostly from power plants. And so, you know, what you see, ACOG, American College of OBGYN, came out with a warning on their website that basically said, if you are pregnant, do not eat fish more than twice a week because of risk of heavy metal toxicity. Well, that's a pretty stupid blanket statement because not all fish are created equal. Turns out that the fish that are caught in the ocean or farm raised are far less concerned about, you know, yeah, I don't want a pregnant mom, lactating mom to run into the Missouri River and catch you when she's out of that river, because there are concerns about pollutants and toxicity and mercury and heavy metals and so forth. So that's really an important issue for us, you know, in terms of counseling the moms. But that DHA intake is important. So not all fish are created equal. If you go to EPA website right now, and our parents don't know this, they see the warnings that don't eat fish because your kid's gonna be autistic. And we're all suddenly going to say, whoa, 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 your kid needs that. DHA as a building block for their brain and their vision. So they need a safe form. Now the good news is, and I take fish oil, some of you may take fish oil, there's a ton of heavy metal tested negative fish oils on the market right now. You can go into Walmart and you can see they're all UL label, and because they don't grind up fish in a Bassomatic and dump it into a capsule. They don't do that anymore. Basically, it's algal oils, or it's, you know, strictly ocean caught, Nordic, or whatever, where you don't have basically the worries about that. But our patients don't get it. So I think we have a job to ask them, are you taking it? And fish are, at the EPA website, I started to mention to you, you look at fish intake, they actually have a red light, yellow light, green light. They differentiate fish. There are predatory fish, shark, and you know, large, huge ocean-going, that eat other fish that have very high levels of mercury and heavy metals. And then salmon and tuna, you see that there's safe fish that are green, and they can eat them every day if they wanted to. So that it really is an education that we have to do. It's really critically important. The whole story of prebiotics, and like I said, breast milk has prebiotics in it. One of the advantages to using breast milk is it's in there. God put it in there. It's a great job. So as I mentioned to you, the prebiotics are like fertilizer. So they support the growth of beneficial bacteria. We all know this to be true. This is why breastfed babies have yellow stools instead of brown stools. Breastfed babies, you know, many times the only time you know they've crapped in their diaper is when you open it up and look at it or hear it come out, because you don't smell it. You know, that stink that comes from formula-fed stools and regular foods, it comes from when the various bile pigments are changed and metabolized by the microbiota into the stercobilinogens and the other brown pigments, and also changed for the smell. Okay, so the reality is prebiotics from formula and from breast milk really will loosen the stools. In fact, many times they're called a laxation effect. They help soften the stools, you know, when you put enough prebiotics in there. And they also have other good benefits. They inhibit for pathogens and binding of them and so forth. When you look at the effect on breast milk or formula that had prebiotics added, you can see that in the case of the yellow here, by adding PDX's polydextrose and GOS's galactosaccharide, these are prebiotics that are there that literally change the microbiome. Just like if a child is vaginally delivered versus C-section delivered, you check that baby in 30 days and 60 days. The microbiome of that baby's gut is totally different if they're breastfed or they're formula fed, if they're vaginally delivered or C-section delivered. So that's important for that child's overall immune system and a lot of other factors involved. So this is basically talks about it. The whole logic here is these prebiotics, we can't digest them, we don't absorb them, but the bacteria in our gut love them. So they metabolize this in various parts of the colon, in this case, to optimize good intestinal microbiome. That's what breast milk does automatically all the time. But we can also screw up mom's breast milk. We're good at doing that too, because we give antibiotics. And it used to be thought, when I was in medical school, I'm dating myself, of course, it used to be thought that breast milk was sterile. Wrong. Breast milk is not sterile. In fact, bipidogenic bacteria are there by design, and you can actually manipulate that. You know, you can actually manipulate mom's breast milk levels of her prebiotic, of her bifidobacterium herself. We don't want to do that, but you can actually do it in a positive fashion too. You can actually provide, if mom's on antibiotics, you can actually give her probiotics to kind of help, you know, normalize her own intestinal flora and that of her breast milk. One of the newer probiotics is what's actually in human breast milk, 2-fucosylactose. And this has become a big deal. This is a soluble glycan that's present in human milk, and it basically is one of many hundreds of prebiotics, but it really is the, and it's structurally the same whether it comes from human milk or from bovine milk. It's one of the more prevalent ones, and what this does is this has impact on the microbiome of that baby's gut as well. So in summary, prebiotics support infant gut health by promoting the growth of beneficial bacteria. The prebiotics, glycosaccharide, polydextrose, and 2-fucosylactose support growth. They actually have an immune benefit here. We'll talk about that in just a second. Lastly, I'd switch over to DHA in the brain. I think this is, we can get this in pediatrics. If you look on the left-hand side down here, this is brain weight. The dotted line is when the baby is born. Look at this, the last trimester of that pregnancy, that baby's brain is almost tripling in size. Tripling. Think of it in 3 months from now, you weigh triple what your weight is for today. You'd have eaten a hell of a lot of food, wouldn't you? I mean, so you think about what that baby's needs are from a protein standpoint, a calorie standpoint, and so forth and so on. In the first year of life, the brain almost doubles in size again, and then it tapers off. So we see that basically only 18% growth, 21% growth the rest of our life. But you setting the structure is so critically important. We see that when you look at the DHA levels on the right-hand side, you see that it accrues big time. This is over 15 months. So the DHA in the brain transferring from the adipose tissue to the brain, and we're counting on mom to continue her DHA intake throughout her lactation. And once she stops, we need to make sure that whatever she puts her baby on has sufficient levels of DHA. And this was a fascinating study that basically, we want every mom to nurse. We want her to breastfeed, but not all breast milk is created equal. This is what's important that we don't appreciate. We can't, you move in, you talk to mom, oh yeah, I'm nursing. Okay, check, move on. No. That's when we need to ask mom about her diet, her supplements, to make sure she is getting adequate levels, because this study, this was published a long time ago by Sheila Ennis up in Vancouver. And what you're looking at here, she took all breastfed kids, no formula-fed kids in this cohort. She didn't give them anything. She just measured the DHA levels in mother's bloodstream, in mother's breast milk, in the baby's bloodstream, and then measured visual acuity on all these babies, 2 months of age, 12 months of age. So this is what you see here. She divided them by tertiles. This group was the low, and mothers reflect breast milk levels, reflect baby's bloodstream, just like you'd expect. You know, the diet is impacted. So we see here, in the blue is the median, middle level, and then red is the higher level of maternal DHA. Diet, blood, breast milk, baby's blood, all correlates. And then you look at visual acuity. Using visual low potentials, you recognize that the breastfed babies whose moms had the highest DHA levels had better visual acuity at 2 months and 12 months of age. This is a big deal, because mom's diet impacts breast milk levels of DHA, and if mom does not have adequate levels, her kids have a functional negative impact. So this is why this is an important deal for us to consult and counsel moms to make sure they're getting adequate levels. And this translates into changes not in vision and cognition. So this is a look at a study where DHA levels were given, DHA supplementations were given to babies, and they basically looked at cognitive development using MDI scores at 18 months of age and found a 7% IQ difference at 18 months of age in the formula studies versus the formula that did not have DHA supplement. And it wasn't added in the US market until 2001. Now today, fortunately, there's DHA in all forms, but the levels are different too. Just like levels in the breast milk levels are different. And if mom's levels aren't adequate, her baby doesn't get the beneficial effects. Same with formula. So it's important to understand that. Look at other aspects, attention deficit. Basically, in terms of attention span, the moms who had the babies who had the higher levels of DHA in their formula had an 18% longer attention span than the kids who did not have it. So it's functionally, if you look at vision, 60% of the retinal phospholipids have DHA in them. And studies show us now, this was shown in the 80s in primates. It was shown in Sheila Innes in all breastfed babies when moms did not have adequate supplementation or diet. And it turns out to be this formula studies in kids on formula, same deal applies. If you don't have DHA supplementation, you have a negative impact on vision and cognition. So if you look at verbal ability, this was looking at kids at 5 years of age, the PMOT picture vocabulary test, basically had a 16% higher performance when they had adequate levels. This is a formula study. We've known that breastfed kids tend to be better than formula-fed kids, but it's not all breastfed kids. That's why they have to be stratified, just like vitamin D levels. They have to be stratified based upon maternal levels and baby levels to really have a functional outcome. In the allergy world, we all know that omega-3 impacts that because of its anti-inflammatory impact. We recognize in this case, you see here the kids that had the higher DHA in their formulas had longer before they had their first allergic manifestation and fewer long-term allergies. And it also translates into autoimmunity as well. So DHA and ARA are very important in early life when the brain is rapidly growing. In infant formula and in breast milk, depending upon improved brain and eye development, if levels are adequate. We recognize that it's also lower incidence of infections and allergy and atopic diseases early in life. So the last part of this is probably the most important part, because many of you, right now today, unless you're receiving breast milk directly from mom, or the formulas that have MFGM in them, this is a big thing on the market where most infant formulas on the market do not have this in them. You have to ask, why not? Well, cost to manufacture, cost is the biggest factor. But what is it? What is MFGM? Well, this is a schematic, basically looking at the scanning electron micrograph of the milk fat as being extruded, in this case from a rabbit mammary gland. But it basically, because fat isn't liked in our bloodstream. Our body doesn't want to have fat, so it modifies it into phospholipids, and it basically takes it and kind of, or if it's pure fat like this, it creates a tri-level ball. So it's just like if you have oil and vinegar or oil and water, mixed, you see the droplets form. Now, if you add soap, you can emulsify and break up that fat. And that's basically what the MFGM is. It's like adding soap to oil. So what we see here is the MFGM, or this component here surrounding the triglyceride core that helps to make it polar, because our body does not like to have fat circulate, period. It's fatal if that happens, fat embolism and so forth. So we have to solubilize that by having the polar part of the phospholipid directed inward with the triglyceride, and the non-polar part, vice versa, the non-polar part directed inward, the polar part being directed outward. So it's really critically important structurally for that to happen. And guess what happens in that membrane? There's all kinds of other good things. Gangliosides, like lipids, phospholipids, sphingolipids, and proteins. All these are critically important, as you'll see, because historically, when formulas are made, this was discarded. My parents used to be dairy farmers when I grew up as a kid. They, the first thing you did when my dad milked the cows, he would dump it into a separator, because on a dairy farm they have separators, and then you sold the cream. That was kind of used for ice cream and things like that, separate from the milk. Now you have to kind of go through the homogenization and pasteurization, so that you have it. But in the real world, that fat layer wanted to kind of separate, and that was typically discarded. And so what the biochemists did, all the formula parts, they took basically skim milk and then would try to add back in what were obviously observed, things like DHA and ARA in the breast milk levels, to try to make them similar to breast milk. What they couldn't create was MFGM until 10 years ago. They didn't create it, they just learned how to separate it from human and from cows. The thing that's amazing is structurally, the MFGM is the same across species of males. So what we see, the data basically is very encouraging, actually, because in the mammalian world, there's been preservation of the MFGM. So the functional outcomes, whether it's human source or bovine source, functional outcome is remarkably similar. Why is this important? Because myelinization really is associated with improved cognitive ability, improved myelin speed, axon transport, and we know the key nutrient components of myelin sheath are long-chain polyunsaturated fatty acids, choline and betaine, and the other sorts of things, acetins, methionine, folic acid. All these methyl transfer groups are essential, critically important. Phospholipids and sphingomyelin, iron, zinc. So we know nutrient deficiencies can disrupt this big time, and it really is critically important. So if you look at synaptogenesis, it occurs at the higher rate during the first 1,000 days than any other time in life. This is sort of a schematic picture at birth, day 300, of synaptogenesis until the child is actually 2 years of age. It's kind of reached, quote unquote, neurologic maturity. So the thing that's fascinating, we know myelinization is critically important for speed of conduction, faster conduction of nerve. Evidence show abnormal myelinization. We know that, various Wernicke and other sorts of, the devastation effects when you see kids that have abnormal myelination disorders. Devastating, devastating. The flip side is true. They need to have optimal nutrients. The foundry. If you look at it on the right-hand side, this synaptogenesis, this blew my mind. Synaptogenesis occurs, look at the last thing down the bottom, in that roughly 8-month window. 1 million new synapses are formed each second. 250,000 axons are formed each minute in that first 1,000 days. Think about that. That baby's brain is making a 100-story skyscraper every 24 hours. And you're hoping that you have enough windows and I-beam girders and bricks to build your skyscraper. What if you're missing a brick or two? Not the end of the world. If you're missing steel I-beams, that's the difference between some of these nutrients. Functionally speaking, in the brain development, these modified lipids, glycolipids and so forth, sphingomyelin, are critically important during that stage to create that million synapses being formed every second. Mind-blowing when you think about that. So it's amazing more kids are born okay. When you think about the potential, we see the impact of maternal malnutrition. We see the impact of starvation on kids. In fact, we have, thanks to World War II, we saw some starvation studies in Leningrad. When the Germans surrounded Leningrad and starved. Fascinating what came out of that. It turns out, entirely upon the age of the child. If you starved a child 5 years of age or older, you stunted their growth. No surprise. But you didn't steal their IQ points. You starve a child in the first 1,000 days, which happened. You devastate that child neurologically. So that's why it's so critical, the stage at when this happens. So let me show you some of the data for MFGM. It's mind-blowing, impressive, and it explains why breast milk is the gold standard. Now, every child, if I had my way, every drop of infant formula would be just like breast milk. And the levels would be measured, and they'd all be perfect. Well, I'd have to be a multi-trillionaire to do that, because it costs a lot of money to separate this and put it in infant formula. So that translates into more cost. So in this study, this is some 12, 13-year-old data. Very impressive, where kids were randomized to receive red is standard formula, blue is MFGM supplemented formula, and yellow is a breastfed control. And they basically looked at the 24-week change in the Griffith's mental developmental skills, more of a British tool than an American tool, but it basically showed that at the outcome, you could see that lipids derived from MFGM in blue had significant performance scores with huge p-values with regards to performance and hand-eye coordination and total score. Now, if you look at the breastfed control in this case, this is looking at Bailey 3 developmental at 12 months of age in a non-supplemented formula, in a supplemented formula, and a breast milk control. So what they showed is that fascinating data that basically shows you can see that both the breastfed group in yellow and the formula-fed group with MFGM in blue had significant 4-point improvement in IQ score. And this was the first study that basically, because we can show you studies at age 18 And age 29, in the European literature, because they can follow these kids long-term with their health system, this shows breastfeeding translated into improved IQ development and outcomes at age 18 and 29. In finance things and salary, all that kind of stuff, even when controlled for maternal smoking and income and so forth. So clearly that's the gold standard. So now breastfed have always had a higher IQ comparison. This was the first study that basically said that the MFGM supplemented formula did as well as the breastfed control group, both of which did better than the non-MFGM. So clearly it's important. There's some other great data. Sean Dion at Brown University does these functional MRIs. I mean, it is incredible to see this data. I've heard him talk, and it is, if we ever get a chance to have him come and talk, this would be an unbelievable grand rounds. He actually has the ability to do MRIs on these kids as infants. He's got a whole technique for doing, wait till they go to sleep and turn the noise down, all this kind of stuff. Amazing. What he's shown is he looks at breastfed controls, non-MFGM supplemented formula, and MFGM supplemented. And what you see here, the pink is the MFGM supplemented formula group, blue is the breastfed control, and then the gray is the non-MFGM supplement. And based upon structure, the whole brain, the parietal lobe, corpus callosum, the body, the splenium, all of them have improvements in the structure. Their skyscrapers are getting built with the more optimum structural, which we know causes functional improvement based upon the MFGM intake. So unbelievable, great studies. When you look at neurodevelopmental outcome, this is another study. You look at Bailey-III developmental where you have standard and MFGM breastfed control. And once again, MFGM formula, breastfed control, better than the non-supplemented formula. When you look at short-term memory, you also look at the serum gangliosides. Their levels are more reflective in both the breastfed and the formula-fed MFGM, but better than the control. So this is a functional structural relationship that we start to understand why breast milk is so good. And if you have a mom who can't or won't breastfeed, which sadly by 6 months is majority, we want to make sure that that child is getting what they need during that first 1,000 days. So if you look at this is a fascinating study looking at preterm infants, kids less than 1,500 grams, with our neonatology colleagues. And these are that we all know about. These kids born are deficient already in most macronutrients. In that last transfer, that last 3 months is when your LC PUFAs are getting transferred, and all of these things are so critically important. So you see in this case, there's a standard formula versus sphingomyelin supplemented or MFGM supplemented. And then their endpoint in these very low birth weight kids were Bailey scales of infant development 2, Fagan 2, visual potential, attention, and memory span. So what we see is that the kids who got the MFGM supplemented sphingomyelin group had better Bailey's, had better sustained attention, had better Fagan. So it really translated in the highest risk kids that we think about, making sure that those kids get the optimal formula. This was an interesting study because it's done on older kids. The kids are 2.5 to 6 years of age, and they put the MFGM into chocolate milk rather than infant formula. But this is looking at behavioral outcomes, why this MFGM is important. It's important for all of us. In fact, Sean Dion did some elderly studies. And we're all focused as pediatricians on kids because it's so important structurally to build that skyscraper good. But it actually impacts some of the issues with dementia and some of these other things, just like vitamin D does too. So it's really exciting to me. This was studied at 2.5 to 5 years of age. Now, in this case, they had a behavioral assessment using the Octobox system of empiric behavioral analysis, and then a number of days with diarrhea, coughing, or constipation. We look at it, so behavioral as well as immune related, and look to see did MFGM supplemented in chocolate milk to these kids, toddlers, early school age, make a difference. And their outcomes, look at the p-values, dramatic. So the kids, in their internal problem scores, anxiety, withdrawal behaviors were significantly better in the MFGM group. External scores, aggression, and total scores, all of them were better. So really provocative data on showing some of the beneficial effects of this structural functional. Now, this, you can't read this. I'm just going to read for you. This is an MFGM plus lactoferrin infant formula study. This is looking at long-term impact. And the lower right says added milk-fat globule membrane and lactoferrin had persistent effects in supporting neurodevelopment at preschool and up to age 5.5, double-blind, placebo-controlled. The next study was, this is a long-term, this is 14 years of age, once again, MFGM supplemented as an infant, And what they did is basically showed that executive function was better at age 14. And this is not surprising when you think about we're building that skyscraper, we're building a structure, you want to make sure all of the parts are in that thing, and then you put people in the sky, you put knowledge inside the brain. So that's why the structural functional relationships are so critically important in this. So the summary of MFGM and what it does is basically we see cognitive scores improve, IQ scores improve, language domain scores, attention scores. We narrow the gap between breast and formula fed for the first time in any nutrient. DHA had steps in the right direction. MFGM appears to be the secret ingredient, so to speak. The brain structure myelinization, functional, structural MRI of these very critically important areas, short-term memory score, visual potentials, cognition, and long-term developmental impacts. So we recognize that when we turn from cognitive to immune, we all know that breastfed kids have fewer infections, mediated through everything we talked about, MFGM, the microbiome effect, the gut, all that kind of stuff. So in this study, what they did is they looked at immune outcomes. They're looking at infectious disease stuff. Once again, standard formula with MFGM, breastfed control. And what they showed is just like breastfeeding, having improved immune benefits, reducing incidence of otitis media. In this study, the double-blind placebo-controlled, the standard formula without MFGM had 10 times the amount of ear infections, double-blind placebo-controlled, than did a breastfed control group or the MFGM formula group. So why? Well, lots of factors, but it appears that MFGM, in addition to being structurally important for functional structural development of the brain, also modifies the microbiota of the gut and the hypopharynx. So it turns out that when you look at GI and respiratory side effects, you see that the MFGM and all side effects, all GI events, diarrhea, constipation wasn't different, but the others were, and we look at all respiratory events. You say, well, I don't understand. Well, that's all microbiota inflammatory mediated, if you will, cough, a URI, and all respiratory infections. So it appears that it modifies, just like in breastfeeding, modifies the enteric microbiota and the oral microbiota. We don't think about that, but the oral microbiota plays a big role in our dental health, if you will, a huge thing. You know, and dentists have recognized this for a long time. My daughter's a dental hygienist in Lynchburg, and she's been showing me stuff about the oral microbiota's effect, you know, in terms of health, cardiovascular health. We all see these people with gingivitis and periodontal disease. We don't realize that this is all having significant impact on that person's entire health, cardiovascular-wise and otherwise. So it's important when you look at this study. On the left-hand side there, the line, these are all the bacteria. You can't see those, of course. On the left-hand side is the MFGM formula. On the right-hand side is the standard formula without MFGM. And if you go down to where the box is down here, you see that one of the impacts of MFGM is that the standard formula had 4 times the amount of Morax catarrhalis in the hypopharynx than did the MFGM formula, or the breastfed group. And this has to do with that impact on microbiome and the fact that that pathogen is readily there, and it seems to be inhibited in the case of MFGM. So it also has beneficial effects in terms of impacting duration of fever. Once again, double-blind placebo control, where you see the study formula reduced fever in these kids. So take-home message today is basically pregnancy we know is critical period during maternal nutrition is key. You know, you guys are here, and I'm so glad you're here because we get nutrition. I love pediatrics, and what we do impacts these kids for 80 years. 80 years. No other discipline in medicine has that combination of really get to build this child for their lifetime. Like I said, I wish the room had as many obstetricians here because they get first crack at it, and we're sort of left to pick up the pieces sometimes. I always joke about this. Obstetricians look at the baby as a tumor on the mother that must be removed. I'm being facetious, of course. But we view it as a blessing from God that, bring it on, baby. But the reality is, the OB clinic, they're worried about CMV status or their HMV status or premature membranes. They don't get nutrition like you get nutrition. So embrace that. Do what you can to make sure that mom's getting adequate diet. You know, educate her. Have a link about the the different kinds of fish. I don't want you driving through Long John Silver's 3 times a day thinking that you're helping your baby. It seems like we know this to be true from our anti-vaxxers. It's like, don't bother me with the facts I've made up my mind. That happens a lot. But we have a shot at educating, and working on them and helping them with the prenatal vitamin, helping with the diet. So yes, fish is good, but it's important where you get your fish from and where you buy it from and all that kind of stuff. We know optimal nutrition is essential for that first 1,000 days for critical fetal development. They're building that skyscraper 100 stories every day. So we know how important it is to have that for fuel and for all the critical macronutrients and micronutrients. When you add it to formula, prebiotics help. They basically are building fertilizer for your lawn. So the prebiotics do good things. DHA and ARA, critically important. Vision, cognition, been shown for decades with primates, with humans, but levels are important. Mom's levels as a breastfeeding mom. Her diet's critically important. Is she getting a supplement? And if you have donor breast milk, make sure that mom's getting that DHA supplement and taking her prenatal vitamin for as long as she's pumping. If she needs it, we gotta have better levels for the kids, for those kids who are getting donor breast milk, because the levels stink. They're deficient in DHA from donor milk. So, and lastly, the MFGM components have demonstrated show improvements in brain development, immune function, and gut health when you add it to the formula. It's in breast milk already, been there, done that. It needs to be added to every infant formula. So let me give you some board type questions, because I know the residents need to kind of be thinking about this. This is a 2-week-old infant, premature. Birth weight is only 1,200 grams. Uncomplicated history of an old transient hyperbilirubinemia. Received fortified breast milk until discharge at 36 weeks. Mom wishes to discontinue nursing. Unfortunately, real common. And sometimes you can't convince them otherwise. Now, the good news is, in 2025, better breast pumps, better recognition of moms needing longer pregnancy, longer lactation periods. When my daughters were delivered my grandchildren, they got 6 weeks. Now, a lot of companies are supporting moms, even dads, and giving them time off to bond and nurse. That's the whole idea. So we want to make sure we do what we can, make sure that you talk to Dr. Kagan and make sure that you do everything possible to encourage the lactation process, okay, and educate them about their role in terms of the diet. So mom says, okay, just like it happens, I want to be switched to a term cow's milk formula instead of a breast milk. If done, what condition would the infant be at the highest risk for developing? The choice would be acrodermatitis enteropathica, which would be kind of a zinc deficiency, cow's milk protein intolerance, hypervitaminosis A, or prematurity. And this is the same reason why we don't give whole cow's milk to babies. So we recognize that osteopenia would be very common. That's why there's transition formulas. That's why there are human milk fortifiers from human sources and from bovine sources. The whole idea is to try to meet some of that needs. When you look at what that baby is needing on a daily basis in the last month of pregnancy, they're pushing close to 5 grams per kilo of protein need. Well, the placenta can do that, but no formula created on Earth can. It's just, you can't put that much protein, through the gut, So it's one of those things where we try to do the best we can. There's these things called transition formulas. You've seen this, they kind of go from the preterm formulas to the transition formulas when the kids are getting kind of post 36 weeks and beyond. And then usually everybody does that a little bit, some people say, I'll just give them transition formula to their 9 months of age. Other people are checking alkaline phosphatase to make sure they don't have metabolic or osteopenia. It's kind of whatever, the different choices about that. Second question, persistent vomiting, 2-week-old. Standard cow's milk formula, 4 ounces every 2 hours. Vomits with almost most feedings despite burping. Non-bloody emesis, non-projectile, 3 to 4 stools per day. Weight gain surpasses birth weight at 2 weeks. And the exam's unremarkable. So you see the choices there. And in this particular case, this is an overfeeding situation where, and unfortunately we see this a lot, our moms they're being told by grandma, just somebody put some cereal in there and they'll sleep through the night and whatnot. And it's just a matter of you overfeed and get too much volume, that a burp then becomes a puke. We all know that if you gave a 1-month-old 3 8-ounce bottles a day instead of 8 3-ounce bottles, then in fact what happens is the kid you've given the 8-ounce bottle to has puked 5 ounces everywhere around the house over mom's shoulder, and they're actually taking 8 8-ounce bottles and they're puking half of it. So just pause them, break them, don't let them overfeed during that time, because it's a real issue. And that moms get crazy and say, hey, just, walk them around, don't let them go more than 4 ounces, just because they seem like they're hungry. And the typical number, last question, typical number of neuronal synapses created in the last third of the baby's first year of life in normal childhood development are, there's your choices. 250,000 per minute, that's the axon creation. 250,000 per second, 1 million per minute, 1 million per second. And the answer is the last one, mind-blowing. 100-story skyscraper in 24 hours in each baby's brain. So anyway, that's my email address. And many of you, are there any guys, besides Amy, anybody that is not getting my emails on a regular basis of these nutrient stuff? If you are, you can just send me a note, say sign me up on your blog. What it is, I send this out multiple times. I don't know, what do you think, John Mark? Maybe 3 or 4 times a week, something like that. And I love nutrition. It's why we do what we do. And so whenever I scroll hundreds of articles a day, that's a sick hobby. I want to acknowledge that. But I just love doing this, because I think if we have such impactful discipline. It's what I love to do. It's why I'm glad you guys are here, because we make a difference for decades in these kids. So I thank you guys for coming. I'm open for questions. We've got a few minutes left. And Amy, I'm signing you up.
I'm going to ask a question.
Yes.
Since you, spotlight on me. So you talked about the developmental outcomes, the PPPT, that's going to be your expressive language. The Bailey is going to be your fine motor, your gross motor, your adaptive, social, emotional, vision improvements. Any research specifically highlighting hearing improvements?
About hearing?
Huh?
I don't know any research. Now I'm going to go back and do some research on that.
I thought, otitis media, that certainly will impact it. But.
I mean, one would think, based upon the structural function of the nerves themselves and the myelinization process, they're so necessary for the auditory, that absolutely, I would predict that just because it hasn't been looked at doesn't mean it doesn't exist. So they're big on doing visual low potential, but there's no reason they can't do brainstem auditory. And I'll check in on that, because I believe the answer would be yes, but I'm speculating because I don't know the data. Great question, so.
It's definitely not well spread. I've never seen it on my list of reasons, but otitis media is a direct correlation.
That's great. Thank you for coming.
Thank you for giving me a shout out. I was in the car listening.
Well, I'm biased, but use Rachel, Dr. Gagan. We need to do what we can to support moms. It's better culturally, we're moving along, breast pump's better, but that is so important. Maternal diet, while she's lactating, is really critical to the time that the last drop of breast milk comes out. And I don't think that gets enough. John Mark. Yeah. You mentioned the MFGM containing formulas, that's a higher cost for the producer. Yeah. Is that a cost that gets transferred to the patient usually? Yeah, these higher cost. The products are, if you look, there's 3 product lines in the United States right now. I did some research on this to kind of just ask who has, Mead Johnson, like I said, I'm a speaker for Mead Johnson, is the only company that has actually done scientific study and published the data on taking the MFGM that the Europeans were finally able to isolate and put it into formula and see beneficial outcomes that I showed you, executive functions. Now, their products that have it in there have the name NeuroPro on the label. Just so I'm a speaker for them. The problem is that NeuroPro is more costly than regular formula, and NeuroPro is not covered by WIC. It's the highest need for the spatial patients we need. It is what it is. Now, the good news is it is in Infocare. Infocare is Mead Johnson's transition formula from the preterm to that child born premature. Stay on that formula, I would say 9 months, but technically you can, it has to do with metabolic bone disease, higher protein, higher calcium, phosphorus, and so forth. Infocare has MFGM in it at no extra cost, covered by WIC in all 50 states. So absolutely, it's not in any other transition formula. And they had to, and just like twice the levels of DHA in all the Infamil line as opposed to the Abbott line. And so it's important to understand the differences because the cost on the shelf isn't different unless you buy the NeuroPro line, Gentle Ease, NeuroPro, regular Infamil. And that is a shame because it should be in there in all formulas at some point. It's just a real pet peeve. That's why I want breastfeeding to really be nurtured, encouraged, pushed, you know, and improve mom's diet, make sure the prenatals, make sure mom's getting adequate levels of DHA herself, getting her fish on a regular basis, but healthy fish, not toxic fish. So it is what it is. I mean, the sad reality is the best thing we could do is encourage nursing, have them, you know, for those moms though that don't want to, for whatever reason, absolutely the transition form is great, and that will be covered. That will be covered, but the regular Infamil NeuroPro is not covered. It's a shame. The cost of manufacturing this stuff is enormous. So it's one of my biases. Someday it'll be covered. Someday all formulas will have MFGM in it. I wouldn't let my kid not have MFGM. I want to have the smartest child, grandchild, whatever. So it's really critically important, and it all starts with breastfeeding. But we have the burden now of making sure moms are educated about their diet and their levels, and I want those kids that are breastfed to have really good breast milk. You know, I mean, we don't realize that we can modulate our breast milk concentration significantly. So I know I'm behind time. Listen, you guys know how to reach me. Any questions, please feel free to shoot. Thank you guys for coming.